So my role is the global head of healthcare buildings. So that is purely focused on the buildings and infrastructure needed to deliver healthcare. We've got a long established healthcare business in Africa. Middle East is another key centre, and Hong Kong. So they have been primarily the key centres, with a growing business in Australia. And then we're looking at other areas such as the US and China. So we've got an international health business which is really focused on programme management of healthcare programmes in low to medium income countries. So using grant and aid money to really help introduce the provision of basic healthcare systems. We've done a lot of that work in the likes of Africa. So that is the international health part. The second area is really healthcare consultancy, which is primarily a UK focused area, which is really the strategic healthcare planning. Doing a lot of service transformation, service efficiency reviews, demand and capacity modelling. So they are two separate components but joined up to form the overall Mott MacDonald healthcare offering. We're constantly able to share, understand what's happening in these different geographies, and then share the best practice and introduce to clients, best practice that we have seen in other geographies. And having that all tied up, which is effectively my job, is a real added value that I think we can offer. And a typical example is that we are designing the first proton therapy facility in Hong Kong. So there are currently 2 of these facilities being developed in the UK, but they are few and far between. So the fact that we are in the middle of designing the proton therapy facility in Hong Kong gives us that insight into what these facilities look like. They are very different in terms of the configuration of the building to suit the new equipment and technology. We've got a client in Australia who is looking for experience of proton therapy. So immediately we can connect the Mott MacDonald business in Australia to the team in Hong Kong who are currently going through that design process. And so the client we've got in Australia directly gets that experience and the benefits of what we've learned going through that first project. Our Go Digital initiative is focused on, firstly, how we digitalise how we deliver our services to get increased productivity efficiencies. So that might be how we digitalise how we would perhaps design a hospital or a wastewater treatment works or a tunnel or a bridge. But the second part is really the smart infrastructure part of the Go Digital initiative. So this is about how we can work with our clients to really deliver smart technology and infrastructure. What is it that hospitals can have to make them more efficient buildings, make them easier to use, make them better for control of infection, make them better value for money to run, and increase the productivity. That we really are working with our clients to think about, what is it that we can do to help them deliver smart technology. Our view as a business is that collaboration is always essential. So what we try to do generally is, partner where we see that the collaboration adds value and actually there's benefits for all those who are collaborating. When you go outside the UK, this is when collaboration becomes even more important. You've got different rules and regulations and laws in these different countries, and if you're from the UK trying to do business in these other countries, it's very hard to do that. Now obviously Mott MacDonald, we're a global company, so we have a lot of presence in many countries around the world. And so, for example, in a situation where the NHS has got export ambitions, I think by collaborating with Mott MacDonald, they can get over that first hurdle of actually just understanding simply how the law regulations work in those countries. And sometimes it's as simple as, being able to go to meetings and understand the culture, understand how business is done. And there are places, that we would go sometimes where we don't have a permanent presence, and in that scenario, we would collaborate with in-country organisations. So I think collaboration is absolutely fundamental, A, to bring together the skills that are needed to deliver a full opportunity, which tend to be, you know, more of a full service offering when you go outside of the UK, but also the collaboration just to deal with the practicalities of doing business in different countries with different, you know, governance and regulations.